She was jogging when she suddenly froze. She wasn't in pain, more confused. Her heart wasn't racing, not exactly. It was pounding in reverse. Every beat felt like it was pushing backward, like blood was flowing the wrong way. An avid swimmer who trained for her first 1K, she prided herself on being healthy and in control of her body and her schedule. Then lightheadedness while standing up, cold fingers and a strange pulsing upward in her neck. Then came the backward beats, like her pulse was pushing away from her extremities. So when her body began breaking its own rules, she couldn't understand it. Doctors said that was impossible until the echocardiogram proved otherwise. Welcome back. I'm here. Today, you'll meet the woman whose heart reversed direction. It felt like I was being pulled inward, like my own heart was rewinding. They found that the blood in her heart wasn't flowing the way it should. Chambers were contracting in the wrong order. Her heart wasn't just malfunctioning. It had reversed its pumping direction. Normal EKG, normal resting heart rate. They told her to hydrate more and cut caffeine. Her body had compensated also. Let me know in the comments how you think Eliza's heart managed to hide in plain sight for so long. Till next time, stay happy and healthy. But now she was paying the price. She'd experienced mild symptoms for years, but now her heart was essentially finished compensating. Another doctor suggested panic attacks. They all agreed it was likely psychological, but Eliza knew this wasn't anxiety. Something inside her was literally reversing. With surgery, one day it just might decide it's done. It could flip the heart back the right way. But after the operation, she admitted, it felt weird, like part of me was supposed to be somewhere else. She tried to ignore it until one day she nearly fainted in class. That's when she knew something was seriously wrong. At 41 years old, Eliza was a high school science teacher. That's a rare form of a rare condition. CCTGA is an ultra-rare congenital defect, where the two main chambers or ventricles of the heart are flipped. Normally, the right ventricle pumps oxygen-poor blood to the lungs to get oxygenated, and the left ventricle pumps oxygen-rich blood to the rest of the body. But in someone with CCTGA, both sides of the heart are working overtime. The right ventricle is doing the left S job, and the left ventricle is doing the right S job. This means that the blood isn't mixing, but it also means that both sides of the heart are under extra strain. Over time, this can cause the heart to get bigger, and it can make the heart muscle weaker. People with CCTGA often have other heart defects as well. These defects can make it harder for the heart to pump blood, and can cause blood to leak back into the heart when it shouldn't. All of this means that people with TGA have to work harder to get blood around their body, which can make them tired and short of breath. Sometimes blood flow appears to reverse, causing similar symptoms to Eliza: fatigue, fainting, and even sudden cardiac arrest. In fact, 50% of people with CCTGA die before the age of 25 without treatment. With treatment, many people can live a normal life, but the heart may eventually decide it's done compensating. It began subtly, a weird flutter in her chest after intense cardio. She never hit the water again. I couldn't explain it, she says. At first, the doctors couldn't find anything wrong with her, so she started avoiding workouts. Her heart didn't feel like her own anymore. But then one day while swimming, it all went black. Lifeguards pulled her out. She was barely responsive. Her heart rate was all over the place. That's when they found her diagnosis. It's a rare form of cardiac situs inversus, with congenitally corrected transposition of the great arteries, CCTGA for short. Basically, the two main chambers of her heart were flipped, but her body adapted until the electrical system began to fail. Her heart's reverse plumbing was catching up with her. When the doctors checked her out for 41 years, the good news is they caught it in time. Doctors say you can live with this for decades, but you never know when your heart will stop compensating. Ultra rare. Thanks for watching. If you enjoyed this video, check out another one.